Welcome to another case study. So today I'm going to talk about this case study which says a 35-year-old female complains of pain 2 days before and 3 days after a period. Then the question is, what is your diagnosis? 2. What are the main points to ask in the history? Then mention two associated two symptoms associated with this condition. 4. What is your diagnosis? Differential diagnosis. Then name 2 investigations to do in this case. So what are we going to talk to handle this one? So this one, from what you have been told, this woman usually complains of pain 2 days before and after a period. So in terms of diagnosis, this is a secondary dysmenorrhea, and the main points to ask in the history. So what are you going to ask in the history? So first, you can ask when did it begin? Is it a new symptom associated with the cycle, or it happened to her from menarche? Or what are the associated symptoms? Those are some of the things. You ask about any family history of endometriosis. Ask about does she has ask about, in short, we are asking about the risk factors. So is the patient nulliparous, or they have had children before? Okay, has it been getting worse with the age? Okay, so those are some of the questions. Then symptoms associated with these conditions. So what are those symptoms? So we have dyspareunia, we can have abnormal uterine bleeding, we can have infertility. Those are some of the symptoms. So dyspareunia, infertility. Okay, then differential diagnosis. So what are the differential diagnosis? Can have endometriosis, can have a pelvic abscess, can have an inflammatory disease, can have adenomyosis, can have a cervical stenosis, we can have a pelvic congestion. Okay, those are some of our differential diagnoses. Okay, so those are some of our differential diagnoses. And the last question is saying name 2 investigations. So in terms of investigations, what are we going to do? Can do an ultrasound. Okay, then the other thing is we can even do a laparoscopy. But remember, those are not the only investigations we can do. We can even mention other things which we have not touched. Okay, so otherwise that's the end of the case study for today, which is a case of secondary dysmenorrhea. And thank you for watching. If you haven't subscribed and hit the bell notification, and check out the other case study.